Hello YouTube, this is Kitty Clinical here with another video, and today we're going to be talking about medical errors. Very big topic today because a lot of people make errors. Nobody's perfect, right? Everybody makes mistakes, even doctors do. So my approach to making medical errors in practice, people make mistakes. The first thing that I always do is I try to admit fault. I admit that I made a mistake and we'll communicate that with the patient, with the family. Because communication is key. Honesty is the best policy, and communication is important. When you communicate, I'd say that's one of the best ways to avoid getting lawsuited, right? Because people are more likely to sue when they don't understand what's going on, when they're angry, when they're upset. When you communicate with your patients, with your family, and you get them to understand your perspective, your thought process for doing things, they will kind of talk it out in their heads, and they will be more understanding of what you're trying to do. So always be respectful of other people. Be professional. When you make a mistake, honesty is the best policy. I do believe that. I would say I've definitely seen, I picked up a patient the day before, somebody made a mistake or something happened. I will go up to the patient or the family who's really upset, and I will explain to them what happened. And that's the best you can do. Apologize and explain, and then you try to move on, or you try to rectify the issue, right? So there's a couple of things about that that I want to talk about, and that is the difference between a sentinel, these different root cause and medical error prevention. So sentinel event, this is described as an unanticipated event in a healthcare setting that results in death or serious physical or psychological injury to a patient, not related to the natural course of the patient's illness. So sentinel events can be caused by major mistakes and negligence on the part of a healthcare provider, closely investigated by healthcare regulatory authorities. And so you want to avoid sentinel errors, but there's very few cases where you'll get sentinel errors. Perfect example, let's say somebody usually takes 40 milligrams of Lasix and you accidentally give them 20 milligrams, right? That's an example of a mistake that you might have made, and they're still feeling short of breath. Maybe their legs are still swollen. Maybe they're coughing a little bit. So you explain to them, I'm sorry, I gave you 20 milligrams. You can always give them another 20 milligrams to add up to their 40 milligram dose, right? That would be one way to do it. But even if you over-dry someone, even if you dry someone out too much, you can just give fluids to them, right? So even for example, in the case of bleeding, for example, if somebody's bleeding and you accidentally give them DVT prophylaxis and they're bleeding even more, you can always give them packed red blood cells and treat the anemia, right? I mean, obviously that's not ideal, but the point I'm trying to make is that you can make mistakes. It's okay to make mistakes. You're going to make mistakes. How do you approach life when you make mistakes? Getting a question wrong on a test is one thing, but getting something wrong in real life when a person's life is on the line is another. So what do you think about this? What do you think about the difference between a sentinel event and near-miss event? Leave a comment down below. I'd be more than happy to share my thoughts and have a conversation with our community. See you later, folks.